So thanks for the introduction, and I'll try to keep this nice and quick so you can all get to lunch. And I'm going to talk a little bit about using multi-echo fMRI. So something that I've been doing. So I've moved recently from University of Manchester with working with Professor Lambert and Ralph, who's now the director of the CBU. And first I'll talk a little bit about what the problem is, and importantly how this can essentially bias the literature in certain ways. I'll talk about potential reporting biases, and then ways in which we in our group at Manchester have sort of used ways to overcome this, and then hopefully potential ways we can implement these ideas at the CBU, which actually isn't novel, but it's hopefully revisiting some of these ideas. So what is the problem? For those of you who don't know much about fMRI, we know that the signal that we get from fMRI is not sampled evenly across the brain. And this is largely due to the fact that in an MRI setting, you have an MRI field, which when you introduce an object, even like a head, which has lots of different densities, it causes distortion in the MR field. And that causes problems with the actual signal you collect. And so two big problems that are quite obvious to see, a signal displacement. So that's this figure on the left here, where you can get this signal pile up in certain parts of the brain, and essentially warps the anatomy, so it doesn't actually look it doesn't reflect the anatomy. And also you get signal loss, and so that's depicted here by areas where you essentially just lose signal, and that's normally at the interface of brain tissue and air pockets. So usually around the orbitofrontal cortex and the anterior lateral temporal lobes. So I'm not going to talk too much about signal displacement today, but I'll talk more about signal loss. And it's mainly due to the fact of some sort of basic physics that the MR machine relies on, and essentially is related to T2 and T2 star decay. So we know that the decay is exponential, and the signal drops exponentially. So you can see here, but what we are typically measuring in MR is this T2 star decay, which drops much more quickly than T2. And the issue we have is we know that different parts of the brain have a different exponential decay. So areas that are closer to these susceptible areas decay much quicker. So as I said, T2 star varies across the brain. There's evidence to suggest it varies across people. But routinely, what's been done in most fMRI settings is there's usually a typical TE value that's used. So this is the time at which the image is acquired after the presentation of a RF pulse. And so here's some typical values on the left here at different Teslas. But what's really important to sort of think about is what is it that we're actually detecting in terms of when we're running behavioral experiments. So here's just a cartoon picture of two lines. You can see the decay. In yellow we have, let's say, a task, and in orange we have a control that we're trying to compare that to. And essentially what you're doing in most of the analysis are looking at this difference of these two lines, and that's the signal that you're trying to detect. And what we hopefully want to do is pick a time from the presentation of the RF pulse where you get sufficient signal and you get sufficient contrast between these two lines. But as I said, because this varies across the brain, these decay curves vary across the brain, it's not always optimum just to pick one particular time point. And it might be ideal to pick an earlier time point or a later time point. And so just to give you an idea of just some data that we have, so here is just some raw data plotted. I've just color-coded the fMRI data, and it's plotted over the T1 scan. And here we have a gradient echo collected at 12 milliseconds and one at 30 milliseconds. So hopefully you can already see that the signal is much higher in the earlier echo, is much redder. But what's important to note is in the 30 milliseconds, you get this area in the orbitofrontal cortex and the lateral anterior temporal lobes where the signal essentially is dropped out. And so you effectively are blind to making conclusions about what's going on in those areas when you're performing any type of analysis. And just to sort of amplify this point, if you look at signal to noise, or something that other speakers have talked about, earlier today. You can see here this issue is much more dramatic. So here in the longer echo, you can see there's a very large amounts of the orbitofrontal cortex and a very large amount of the temporal lobes that essentially have very poor signal to noise compared to a low echo. Now, it's important to note it's not simply about maximizing signal to noise. We also need to think about contrast as well. So, and that's why typically at 3 Tesla, you get images acquired around about 30 milliseconds, because that's a bit of a compromise. So ways in which, at least so in the lab that I work with excuse me, is interested in semantic cognition. And there's a lot of converging evidence from numerous imaging modalities to suggest that semantic cognition is, at least in part, derived around the anterior and inferior temporal lobes. And here's just a few different studies. But so, for example, here on the left, we have a PET imaging study where you can see this areas of activation in red for a task that requires semantics versus a task that doesn't require semantics. And in bottom, they actually compare this with the fMRI, equivalent fMRI study as well. So you can see it misses this area here in the anterior temporal lobes. And this study is a study on semantic dementia cases, looking at atrophy in the brain. You can see semantic dementia patients have problems with semantic cognition. You can see their atrophy is localized in the anterior temporal lobes. Here's a TMS study that stimulated the left anterior temporal lobe, and they found systematic slowing in tasks required semantic cognition versus tasks that didn't. And here's an MEG study again that suggested that reading words and hearing words over time leads to activation of the anterior temporal lobes. So there's a huge amount of evidence and converging evidence for multiple imaging modalities. But there is a problem that there really is very little evidence, at least before we started having a good look at the literature of fMRI evidence supporting the idea of this lateral inferior temporal lobe related to semantic cognition. And this actually is a big problem for a lot of the literature more widely, because a lot of meta-analyses focus very heavily on the results of fMRI studies, just because they outnumber studies such as PET or any studies related to patients. And so here's a recent paper by Kathy Price, and the paper's roughly titled The Last 20 Years of PET and fMRI Studies, and it's a synthesis of language studies of the last 20 years. And so hopefully you could see here in the inferior temporal and fusiform gyres, there's really just, it's not mapped to any behavior, where we know from the converging evidence I just showed you in the previous slide that it is related to some kind of semantic cognition. So a recent paper by Professor Lamb and Ralph. So this is their hub and spoke model, which essentially identifies this anterior temporal lobe as this semantic hub with sensory information feeding into it. There's a lot of evidence in that paper to suggest that you do find activity in the inferior temporal lobes if you use the relevant fMRI methods to detect the activity. And just to add another sort of point of reference is there's a lot of studies now using network analysis, so whole brain network analyses, and they usually are based on some kind of parcellation of the brain, where they use certain atlases that have parcellated the brain and then perform whole brain network analysis. Now, I think this is potentially quite problematic in the conclusions of these kinds of studies, because you essentially are missing the contribution of these inferior temporal lobes. So it's maybe a bit hard for all of you to see, but these inferior temporal regions are missing in the atlas by Power and colleagues. And so essentially what you get from the results after you've done this network analysis, when you've omitted what at least we think is quite an important feature of behavior semantic cognition, how we know about knowledge about the world, it becomes a bit of a problematic, it becomes hard to be clear in what conclusions you can draw from that. And to things that we've looked at, so like I said, with signal displacement, there's a lot of unwarping strategies using field map corrections or reverse phase encoding, which I think some people talked about earlier today, but I'm not going to talk too much about that. So more interested in signal loss. So there's quite a few little tweaks you can do to the actual image acquisition, such as changing tilt, phase encoding directions. you do get small systematic gains, but they're not very big. So in our group in Manchester, we used a method called distortion-corrected spin echo fMRI, and we were able to identify areas in the inferior lateral temporal lobe. So this is a study where it compared a semantic versus number judgment task, and you can see this area here, which is really quite active. And if you break that down into individual bits of anatomy, you can see it's this fusiform, very anterior fusiform gyrus and inferior temporal gyrus that's active. And that actually mimics the atrophy maps for semantic dementia patients as well. And also here's another study which is based on a conjunction analysis. Again, both left and right anterior temporal lobes can be detected if you use the spin echo sequence. And so there's been an idea to use a multi-gradient echo for a number of years, about 2 decades now, and it's been developing slowly over the years. And as technology is advancing and getting better, I think it's becoming more readily available. And so this is something that we used in Manchester. So we know that for spin echo fMRI, I won't go into all the details, but the signal to noise ratio is actually quite low because of the way the data is collected. And there are studies suggest it's about the ratio between gradient echo and spin echo sequence in terms of signal to noise, it's about 1.84. So we directly compared using spin echo, and at the time we used just 2 gradient echoes because that's what the capability of the scanner was. We had quite an old scanner at the time, but since it's been upgraded. And it's quite a complicated slide, but just to show you, this is semantic versus letter judgments. And these are just different ROIs in the brain. But this all plays out at whole brain as well, but this is just to show you what the signal looks like at each of these areas. So this is the inferior temporal fusiform area, and these 2 bars on the right are just the combination of these 2 dual echoes, and this middle bar is a spin echo. So in all parts of the brain, the dual echo was significantly higher than the spin echo. And importantly, in the left inferior frontal gyrus, we didn't find any activity for spin echo sequences, but we did for the gradient echo sequence. So this plays out to the fact that the spin echo sequence is a bit insensitive because it probably is underpowered. And so there's been a bit of debate in the literature about whether there's activity during speech comprehension in this inferior temporal region. So if you look at PET imaging studies, they do consistently find activity in this inferior temporal area, and it hasn't really been reported in fMRI studies. So we conducted an fMRI study where we compared speech versus spectrally rotated speech. So this is just complex acoustic noise that's not intelligible. And we found this area consistently active in this inferior temporal lobe if you use a sequence sensitive enough to detect activity there. And so over the past few years in Manchester, we've been using this dual echo fMRI approach over lots of different studies. And so this is just a summary of quite a few studies that have been published in the past few years. So over the last few years, of course, like I said, we're interested in semantics. So this is 15 contrasts using a semantic task over a control baseline. So it's not rest, it's against an active control. And hopefully I can convince you, so this scale is up until 14. There's a couple of voxels in the very anterior ventral part of the left temporal lobe that was found on 14 out of 15 of the tests that we did. So pretty convincing that if you have an fMRI sequence that can detect the activity there and you'd run a semantic task, you probably will find it. But this goes completely against the majority of what fMRI studies report because they don't have sufficient signal to actually look within these areas. So effectively, they're blind to those areas. And so, of course, the question is, why stop at 2 echoes? You can do more. And like I said, the main reason for us using 2 echoes was just a hardware problem. We were using a first-generation 3T Philips scanner in Manchester, but that's since been upgraded. But with modern scanners, the actual machines are much more efficient, and there's actually very sensible acceleration techniques you can use as well. So, of course, this allows us to better sample T2 star. It proves signal to noise and hopefully is able to detect subtle effects that we're looking for. And you can use it in 3 Tesla and 7 Tesla, and you can essentially just combine them so you can avoid this signal dropout. And there's been multiple developments through in this field in ways in which you can essentially use that information, use this T2 star decay to determine what are potentially noise components and what are potentially bold-like components. So this was an area developed by Partik Kundu and Ed Bullmore. I think it was done here at the CBU many years ago now, using ICA to essentially denoise the data. So here you can see just an example of what a bold like ICA component would look like and what a noise component would look like. And you can essentially just remove noise signals to improve signal to noise. And so one of the downsides of using multi-echo data is because you're collecting more data, the machine is working much harder, and that can increase the TRs or reduce the image resolution. But if you have multi-banding capabilities, you can actually overcome this quite easily. And so since I joined in September, I've collected just the pilot data set on one subject, and these are just the parameters that we use. So in the first row, is a triple echo sequence, just a standard sequence, and you can see the TR is about 2.5. If you use the exact same image reconstruction, but with multi-banding factor 2, you can get the TR down to 1.5. And here the echo times that we used. We used 3, but again, you can use more. It's not all too clear to me if actually collecting many more TEs is hugely beneficial, but at least certainly having 3 is better than having 2, because you can model the T2 star decay. And so here are just some TSNR maps for the data we collected a few weeks ago. So this is on the top, the multi-echo sequence, and this is just essentially an optimally combined data set using T2 star. And in the bottom here, you have the multi-echo, multi-banded sequence. There's not really huge amounts of differences. I can't do any statistics because it's just one subject. And this is what happens when you use this multi-echo ICA approach to denoise the data. You can see the TSNR massively goes up because you're essentially getting rid of a lot of noise. There is a danger to using ICA because you might also be getting rid of task-related noise as well. And lastly, just to show you what the GLM results look like. Although the TSNR maps look roughly the same, the GLM maps were a little bit different, where we found in the multi-banded version the areas where weren't evident in the multi-echo, and they do correspond to areas that are related to semantics. So potentially we're thinking about using a multi-echo, multi-banded approach. And so summary, fMRI signals are not acquired the same across the brain. We originally were using spin echo sequences, but have then moved to multi-gradient echo sequences now. With multi-banding, it seems very feasible. And so hopefully this gives you an insight to the benefits of using this type of approach. And certainly there's expertise here at the CBU to help anyone who wants to implement it. But not just here, in other sites as well, we'd be happy to help implement. But something that's probably worth sort of saying, and is probably not done enough as fMRI users, is to check your data. You really need to check the data quality, what it looks like. Given once you've looked at that, then you can make some more sensible conclusions about what you can and can't say about what you found. So that's me.